for inviting me to speak at Traveling Journey this morning. I miss seeing all you guys. I've been in several times, and you have an amazing program there and an amazing amount of people that come. And I think it's so important, and you're all very blessed that we have this in our valley. So today I wanted to talk to you about how to get the most out of your doctor's visit. And it's a little hard now, like we were just talking about getting in to see the doctor, but especially since we are in the middle of COVID-19 and you won't be able to go in to see your doctor, I feel it's even more important that you're able to communicate effectively with your doctors so that you can get your right diagnosis and the right treatments for you or for your loved ones. So I'm going to give you a few statistics on misdiagnosis or delayed diagnoses that exist in the United States. And the reason I'm doing this is because this will help you, I think, understand why it's so important to have clear, concise communication with your healthcare providers. So diagnosis is the celebrated detective work of medicine. In fact, many sources say that Sherlock Holmes, the character, was based on a Scottish physician, Joseph Bell, who was famous for his powers of observation. The National Academy of Medicine, also known as NAM, defines a diagnostic error in this way: the failure to establish an accurate and timely explanation of the patient's health problem or problems, or communicate that explanation to the patient. NAM launched the first comprehensive study in the United States on diagnosis in 2015. And here are some of these staggering statistics. 40 to 80,000 hospital deaths each year can be attributed to a diagnostic error. And this was in an article back in 2002. The top three diagnostic errors that occur are in relation to vascular disorders. So whether it's aortic aneurysm, whether you're coming in with chest pain or a heart attack or stroke, they tend to get misdiagnosed a lot. Strokes especially, infection, and then cancer is the third. The study concluded that or delayed diagnosis contribute to about 10% of deaths in the United States, and 12 million adults receive care that involves some kind of a diagnostic error. And these diagnostic errors are the single largest root cause of medical malpractice in the US, and their claims pay like 47% more than any other malpractice claim. So why do we have so many misdiagnoses? What is going on in the medical field? Well, that's something that there's several organizations that are currently studying, but they all say it has a lot to do with lack of feedback and miscommunication are among some of the biggest causes. So this is why when you get an opportunity to be in front of your doctor, I always encourage us to be good storytellers and to be very prepared before we even get into the examining room. So before you go, one of the things you have to do is pay attention to your body. You know your body better than anybody else, better than any of the specialists that you will ever see. So you need to be able to recognize when something is not right. If you experience a physical change that is concerning, take the first step and make the call to make the appointment with the doctor. The other thing is that you need to be able to record all of this. And I find a lot of times, and I've done this myself, where you may have a cough for a week or two, or a backache, and you go and you finally make the decision to go see the physician, and they're like, well, when did it start? Well, I think a week ago, maybe it was 10 days ago. It's really important that we provide the doctors with all the information that we can so that they can come to the correct diagnosis and give you the correct treatment. So one of the handouts that I sent out, and Priscilla has, it's called My Symptoms / Pain, and it's called Patient Kit for Diagnosis. And on here, what I encourage people to do is, as soon as you start to have that first pain or that first symptom, write it down. Write the date it started, write what it felt like. You could, if it's a back pain, you can mark it on the little chart here, or you can document, this is when this developed. I started to notice I was short of breath. I started to develop some symptoms of allergies or wheezing. And so you can document all this. You know, I even tell people, put a Post-it note and stick it on your refrigerator. On this date, I noticed I developed these symptoms, because that really helps the doctor figure out how long this has been going on. And that's important information for them. So you need to always do that. And then the other thing you always need to do is have all of your medical information handy and up to date. This is really important when it comes to going in and visiting the doctors. You know, a lot of times once we get into the examining room, you know, they hand you that clipboard and there's like 8 sheets of paper on it, and you think, oh my gosh, I got to fill this out again. Even though it seems tedious and time consuming, it is extremely important that they have all of your current and relevant information. And they need to know everything. They need to know what other doctors you're seeing, because sometimes doctors don't communicate between each other like they should. They need to know all the medications that you're on, what recent tests you've had done, and what supplements you're on. It's really important to talk about your supplements, because there's a lot of vitamins that don't interact well with some of the medications that physicians may be prescribing. So that's very important information to always have. So I always like encourage everybody to keep really good medical histories. Document when you had your last lab work done, maybe get copies of the results, when you had your last x-rays done. You know, for women, you know, it's when you've had your last mammogram, it's when you've had your last colonoscopy. All of these things are very important for the doctors, and sometimes they keep track of it and sometimes they don't. And then if we see multiple doctors, like I said, they don't always have all that information. So it's really important that we become really good collectors of our medical health and what we have and what we're taking. So that's one really important part. The other thing is you can always learn about your symptoms. I don't, WebMD is probably not my favorite website, but there are really good choices with Healthline, the National Institute of Health, Centers for Disease Control and Prevention, and the Mayo Clinic. So if you have certain symptoms, it doesn't hurt to get online and just learn a little bit more about your symptoms. Now, the other thing is that once you have an opportunity to get in front of your doctor, we all know that doctors' offices normally are very busy. The average time they give a patient is 16 minutes. So you have a very limited amount of time to be able to tell your story and explain your symptoms to the physician, because part of that time is he's going to be also probably listening to your heart, listening to your lungs, and doing other physical assessments. So I always tell my clients, like, be prepared to tell your story. You know, editors always tell their writers, like, don't lose the lead. And what that means is, like, make sure that you know exactly what you want to say. What is your headline? What is your opening statement when you go in, so that you're going to grab his attention, and then be very concise about your symptoms and your concerns and why you're there. And that will help him be able to, like, sort through your symptoms and come to a more accurate diagnosis. I tell my clients, practice describing your symptoms. I know that sounds, you know, maybe sounds silly to some people, but sometimes you have to say it out loud a few times. You have to have it written down. The other thing is, once you get into the doctor's office, if you don't have somebody you can bring with you, a care partner, a loved one or a family or friend, make sure you always have a notebook. Make sure you have your list of questions for the doctor. These are when my symptoms started, but I have these questions. If he says, I want to run this test and I want you to go here, you ask him why. What is that test going to tell you? If you run all these tests, what are you hoping to learn from that? What do you think I may have? So those are all really good questions to ask the doctor when you're in front of him, and take notes. Now, I've had this experience recently with some of my clients that some doctors won't allow even patient advocates into the examining room with them because of COVID-19. So what we've been doing is, the patient gets in and they call me and put me on speakerphone. And that's something you can do. If you need to go to see a physician and your loved one or care partner can't go with you, take the phone and say, look, I'm not feeling well. I'm probably not going to remember a good portion of what you're saying to me today. I want to be able to put my care partner or loved one on the phone on speaker. And then that way they can hear the conversation. They may be able to ask questions to the doctor that you may have forgotten to ask. And then they can also be a note taker for you and writing down things that the doctor said that he wanted you to do, or his impressions of what he thought was wrong. So with COVID-19, the phone is a really good tool to make sure you have with you when you go to the doctors. The other thing is that, when you're in there and you're talking, sometimes the doctors, and I'm sure everybody's experienced that, you can tell they're kind of rushed. You feel like maybe they don't have as much time for you, but this is where, if you're prepared and you have your notes and everything, as long as you stay calm, you will be able to get the most out of that visit. And make sure that, don't be afraid to ask doctors questions. I know a lot of people are, but you are their customer, and you have every right to sit in front of them and ask them questions. And you know, make them take the time to be with you. And you can, and there's ways to do that. You know, doctors tend to spend, for every patient, they spend about 2 hours doing administrative work too. So they are short on time, but we can help these doctors by slowing the process down a little bit. And then after you leave the doctor's office, if they're ordering tests, you need to ask, because sometimes they don't always tell you. You know, certain tests are not, the doctor's office doesn't order them. They send them off to a radiology department, and that radiology department calls you. It's really important that you understand who's going to call you to either schedule the tests, when you can anticipate getting your test results, and who's going to call you with the test results. Is it going to be the doctor? Is it going to be his nurse? Is it going to be the front office staff? And how long should you wait before you get those test results? Because what you want to know is, okay, well, if I don't hear back from somebody in 5 to 10 days, who can I call to get my test results? And so it's just one of those things we need to kind of like help the doctors in this situation by staying on top of our own healthcare, because we have to help them put this puzzle together, because we're trying to come out with a correct diagnosis and correct treatments. And if we do that by working with them and making sure that we have all of our information. The other thing too that I think is important, and I've just come across this recently with a couple clients, is that it's important that the doctor understands not only your social history, as far as whether you had smoked in the past or drank in the past. You know, sometimes people don't want to admit that in front of family or friends, but that's an important key for the doctors to understand when they're trying to identify what could be wrong or what's causing it. And the other thing too is family history. It's important to know about your family history, because if there has been cancer in your family, the doctors really need to know that, because that gives them a little more information, and it may have them choose to go down a little bit different path in trying to determine what is causing your symptoms. So that's another important thing, is to make sure that you always have your family history to give to the physicians so that they understand that. I recently had a lady who was misdiagnosed because the doctors, for whatever reason, did not take notice the fact that both of her parents died of lymphoma at the age of 69, and she is now 67 and went through 3 years and got misdiagnosed and now has stage 4 cancer. So it's one of those situations where I think it's really important that we have to also learn how to be our own advocates in front of the doctors and in front of the healthcare professionals. You know, you have to advocate for yourself, you have to advocate for your loved ones. And then one of the things that I always encourage my clients to do, and I put it together for them, is a medical history book. So it keeps all of your information in one place. So if you ever had to go into the doctor's office, say you're seeing a new physician, a new specialist, you can have all that in one place. And it has all your pertinent information. It has a list of all your medications. It has a list of why you took them, when you went off them. It has a list of your ongoing current health conditions, your chronic conditions, acute conditions that you had in the past that you no longer have, and how they were treated, all of your surgeries, your procedures, your most recent lab tests, your any kind of x-rays or radiology or imaging. Because sometimes when we go to different doctors, you may have just had a total blood cell count, right? And then you go see somebody else and he's going to order another one. Well, you just had one a week ago. So it's important that you can say to him, look, I just had this a week ago. Here are the test results. This is the doctor that ordered it. This is how you can get those results. So that, one, you're not being stuck again and having to go to a lab, but two, now you don't have to pay for it again. So that's why I think it's really important to keep all of these records together and current, and so that the physicians can get a hold of them. We went over keeping your medications lists current. And now I'm going to talk to you about 4 questions you should always ask your doctor. And this kind of goes to if you think you're going to be having a surgery or not. And this came from a surgeon in the Netherlands, and he was a neurosurgeon. And so he said, you know, obviously as a neurosurgeon, I like to operate. That's what I like to do. But he said he had a patient one time that came in and she had severe neck pain and some other issues. And his first inclination was, well, we're going to operate. And he starts to tell her, I'm going to cut you from here to here. And, you know, and so finally she stopped and she says to him, he goes, it's the first time, he goes, in 30 years of medical practice, anybody ever asked him these questions. The first one was, is this surgery really necessary? He goes, nobody's ever asked him that before. He goes, most of my patients nod their head and go, yeah, this is what we're going to do, but they don't ask. He said the second question, he says, or what are the risks attached to this surgery? He said, it's really important that you understand the risks that are attached. He goes, and make your surgeons and your doctors explain them to you. The third question he says is, are there any other options? You know, and he said, they did a study in the Netherlands on tered meniscus, which is the lining of the inside of your kneecap. And he said, and in one part of the country, all people that had a torn meniscus, he said, had surgery. In the other part of the country, they all went to physical therapy. He says, but what they found was that the results were exactly the same. He said, so in that case, for some injuries, is there another option? It's not always surgery. It may be physical therapy that'll give you just as good as a result as surgery would. And then he said, the fourth question is what happens if I don't do anything? If I don't take any treatment, if I don't have surgery, if I choose not to use the medication? And he says, those are all very important questions, he says, to ask the doctor. And they ended up doing a study, and it said that 20% of patients change their opinions on the treatments when they've asked those questions. That they don't always just take what the doctor offers first. So I thought that was very interesting. That's kind of what I have for today. I would also just encourage everybody in the time of COVID-19 and the fact that you can't get out to see your doctors. I always ask my clients to have what I call an emergency information packet, and I can show you this is kind of what it looks like. And on the inside, I ask them to fill this out and keep it somewhere in the home, especially if you're by yourself. So when paramedics come, they know where they can find this information. And the front of it has your information. So it's going to have your name, address, phone number, your medical insurance, your top 3 emergency contacts. So if you're at home, who can they call? It also has your current diagnosis, any chronic diseases you may have, your primary care physician and his phone number, a specialist, your preferred hospital, because if paramedics are rolling up, they may not take you to where exactly you would prefer to go. And sometimes you do have a choice. What medications you're currently on, any allergies. And then it has, if you have a healthcare advance directive, and I always recommend that everybody has one and you make several copies and that they're always available at your home. So if you had to be picked up and go to the emergency room, or if a loved one had to come take you, they could just grab this folder and all this, because they're not going to let your loved one in the emergency room right now with COVID-19. That way, when you go, all of this would be in one place, and the emergency personnel would be able to find it, and the doctors and nurses at the hospitals would have it. And if you have a healthcare advance directive, keep a copy of it in here. Hospitals don't have to have the original form. They can have a copy, and that's important to have too. And make sure that all your family and friends know what that healthcare advance directive is, what it says, who you're making your primary agent, and they know where to find it. So now I'm open for questions.
Thanks,
if anybody
Cindy.
has any. Oh, you're welcome.
That's awesome. I do have the PowerPoint ready. I don't know if you already covered everything in the PowerPoint. Is there
Pretty
anything
much
that you want to show people? Okay.
Yeah.
Thanks for that. Well, that was great information. And like I said, there are handouts that go with this. If you didn't get them, I will email them to you. But right now, if you would like to either type a question in the chat, or you can unmute yourself and go ahead and ask. Or I can't see everybody on the screen right now. I can just see Cindy. So does anyone have a question out there?
I have a question. Can you hear me? It's Mary Lou.
We can,
Yes.
Mary Lou. Thank you. Go ahead.
I love your information totally. Tell me about the emergency folder, medical information. Do you have in your handout that particular questionnaire or basic content so we can do that based on some kind of format?
Yeah, what I can do is, I don't have that in the handouts that I gave to Priscilla, but I can email her those so she can give those to everybody.
That would be fabulous. Thank you.
Oh, you're welcome.
That would be great to have. Cindy, is there such a thing as too much information for the doctor? I mean, I think people hesitate to sound like hypochondriacs or sound like they're complaining about little things.
No, there's never too much information, because we don't really know. When we give them information, they put it together in a format that helps them put that puzzle piece together. And so I would never say that there's too much information you can give to a doctor. You know, it's just important that they understand all of your symptoms, how it's affecting you, you know. So like on one of the handouts, it talks about pain and where it radiates. It's important that they understand that, you know, what makes your pain better, what makes it worse. What have you taken? I've been taking Motrin, I've been taking Tylenol. That doesn't seem to help. I use a heating pad, I use ice packs, whatever. It's important that they have all that information so that they don't, what you don't want to do is get there and have the doctor say, okay, so go home, put a heating pad on and take some Motrin. Well, and you've already tried all that and it hasn't worked. So no, you need to let them know all that information.
Okay, great. We have a question, and it is, how safe is it to have routine labs done at this time?
It's fairly safe to go in because the medical field is very protective right now. I mean, they're all wearing gloves, they're all wearing masks. They only allow a certain number of people to come in to the labs. And so if you need to have lab work done, if it's something that your doctor is ordering and there's things that he wants to continue to monitor and check for you, then I would encourage you to go do it. As long as the doctor says he needs it, then I always encourage everybody to just go do it. They're very good right now in the hospitals and in the labs and everything. Those, make sure they won't even let you in and out without a mask. So.
Do you feel like things like annual checkups or annual eye exams or dental exams, are they putting those off until a safer
Yeah, the annual eye exams, your annual dental exams, they're putting off. If you're due for an annual physical, you could put that off. I don't think most doctors are even offering them at this time. They're just trying to deal with patients who have acute symptoms and need to be treated. So all of that has kind of been put off. But what I encourage patients, and it's something that we've been reading a lot about, and us advocates have been talking a lot about, is one of our concerns is that you're going to have a symptom or you're going to feel like a lump or you're just not going to feel right. And because of COVID-19, you're going to wait months to go in. And then by the time you go in, what you have has gotten exponentially worse. And so that's one of those things, again, where we tell all of our clients, if you don't feel right, if you think there's something wrong, you need to call your physician, because we don't want people to wait. You know, for cancer, it's the first thing, and they all talk about it, and it's true. It's like the earlier it's detected, the better the treatments are. So it's one of those things where I would definitely get on the phone with and talk to your provider if you are not feeling well and you think there's something wrong. You need to have that conversation with them, either through telehealth or on the phone. And they may even tell you, based on the symptoms you describe and how you're feeling, to come in and see them.
Okay, great. How about donating blood? I know that's so important, but is that something people should hold off on until safer times?
No, we're low on the blood banks there, and they're really needing people to donate blood. And again, because you're going into a very safe environment and very controlled, it is safe to give blood. So if you're healthy enough to do it and that's something you want to do, I would encourage it. It's a very controlled, safe environment to give blood in the blood banks. I
agree, and encourage your families too. I went and did it a couple weeks ago, and they were super secure. Mm-hmm. Okay, question. How about routine things like mammograms? You know, is that something that's still important to do right now, or should we wait on that?
I think they're all waiting on that.
Okay. Another question, what point do families usually hire you or another patient advocate? I know I have all your contact information if anyone's mm-hmm. looking, and I know there's an association, right?
Yes. Yeah, I belong to the Alliance of Professional Health Advocates. I also belong to the Greater National Advocate Association, and I'm also board certified. People hire me for different reasons. So sometimes I get hired because they've gotten a new diagnosis, and now there's all this care that has to be coordinated, where they're seeing multiple specialists. They have to have different kinds of treatments, and they just need help coordinating the care, you know, making sure the doctors are all communicating with each other, you know, and staying on top of them, especially now with COVID-19. I recently had a client who, I mean, she couldn't get the appointment she needed. So I was the one on the phone 4 and 5 times with the same doctor's office, like we need to get her in. She needs to have this done. How can we expedite this? What's going on? So they hire me for that. I get hired when they get what we call an inflated medical bill and they don't think it's right. 80% of your medical bills have errors in them. And so that's something that we do is we look at the medical bills and we try to negotiate with the hospital or find out if they've just coded a procedure incorrectly and are overcharging. So that's another reason that we get hired. Also to research like second opinions for people if they feel like they really need to get a second opinion, if they've gotten a diagnosis, to make sure that they're, and what advocates do is we don't make decisions for our clients. Probably to describe it better is that we provide a roadmap. And so we provide you with options and then you make those decisions. So if you come to us and say, I need help getting, a home care company, I need help finding a specialist in this, we give you like 2 or 3 different options and then let you make that decision. So we help guide you through the process. Somebody described us as guide dogs almost. We just help guide you through the healthcare system. I mean, the healthcare system has become very complicated and it's become very costly. And now with COVID-19, there's even more rules and restrictions than there was before. So that's where advocates can come in handy because we understand all that. And sometimes we can color a little bit outside the lines and know how to get things done for our clients and, get appointments expedited and that kind of thing.
Great, thank you. Cindy, I've a member asking, do you know where one would get emergency dental work done during the COVID-19 restrictions?
What I would do is if you have a local dentist, I would call the office and they would be able to direct you to whether they're coming in on certain days to perform emergency dental or not. But I would call your local dentist, whoever you normally go to for your routine cleanings and exams, and they would be able to advise you on who's doing that.
Okay, great. Another question, let's suppose a family member with dementia ends up in the emergency room and they're not allowed to join them in there.
Right.
How do they reach the emergency room to make sure that the treatment is appropriate? How do they advocate for them when they can't be with them?
Right, you can't, the way you can advocate is you need to, when they go into the emergency room, they won't even let you in. I mean, you're standing out on the curb right now. If your loved one has to go to the emergency room. So if they have a cell phone and they know how to operate it, you can again ask to be, please, I need you to call my wife or my husband or my partner and put me on speakerphone so that they can hear the doctors and the nurses ask questions. Again, this emergency form is really helpful to send that with your loved one to the emergency room so that the staff there has all the important contact information. And they are being pretty good. You call and you can ask who your loved one's nurse is, and then that nurse, they're a little better than probably they have been in the past about making sure that they can call you and have a conversation with you because they know the anxiety and stress it's causing family members or even the patient when their loved one can't be at bedside with them. So they are being a little bit better about being able to call the nurse's station and ask for the nurse and get updates through that way.
Okay, great. That's a great idea with the cell phones. Cindy, how did you get interested in this line of work? What started you on the road to patient advocacy?
Well, many, many years ago, I was a oncology nurse back in New Jersey. And then my career took a different path. I went into medical sales and traveled all over and enjoyed that. And then I became a mother of 3 and decided to just stay home and raise my kids. But my oldest daughter got critically ill when she was 2. And it was an interesting experience, one on the perspective of being a mom now, but also because I was on the other side of the healthcare. Instead of being the one giving the care, I was the one sitting there observing it and watching it and seeing what was going on with my daughter. And I realized that, wow, there's like a lack of communication, that they don't really want you to ask questions, that I had to insist on, nope, we're transferring her. She's going to another hospital. She needs to be seen by a specialist. And I remember saying to my husband, I don't remember it being this hard, but I was the nurse, And then when my parents started to get ill, I started to see the same problem with them. My dad would go to the doctor by himself and come home and he'd be on, 5 new medications. And I'm like, what are you on this for? Well, he couldn't tell me. And I'm like, okay, so from now on, somebody needs to be with you in that room because you don't even know why they're ordering this. And you don't understand the instructions on how you're supposed to take it. And that's kind of when I decided, I looked into patient advocacy because I thought, people need, they need to learn how to advocate for themselves. They need to learn how to advocate for their loved ones. And then there are times when they do need to hire a professional to come in and help advocate on their behalf. So that's kind of how I got into it.
Well, it's so valuable. So thank you. Do we have any other questions out there from our audience? We've gotten some come through chat. If someone wants to unmute themselves and shout out a question, that's fine. I want to thank Cindy again for joining us this week. This was great and so much good information and so timely, just how the atmosphere has just shifted and changed and people are trying to play catch up.
Mm-hmm.
Next week, we have speaker Kathleen Lubanski. She'll be talking to us about relaxation techniques. And Pat could maybe tell you a little bit more about that. But we're very excited to have you be our first speaker.
Well, thank you for inviting me. I enjoy being here. Thank you.
Thank you, Cindy. Just to give you a little more information regarding next week's speaker, Kathleen. Kathleen does a lot of work right now at Lucy Kersey with cancer patients, but her real focus is she is gerontologist, physician,